Part 1. Welcome back to the channel. Today, we are taking an in-depth, comprehensive look at a condition that affects millions of women worldwide, yet remains one of the most preventable and treatable forms of cancer when caught early. Cervical cancer. Whether you are a healthcare professional, a medical student preparing for exams, a patient, or a family member seeking clear, accurate clinical information, this video is designed to serve as a complete guide. Over the course of this video, we will walk through every aspect of cervical cancer step by step, what it is at a cellular level and its primary causes, how it develops and presents clinically, the latest FIGO staging system, evidence-based treatment protocols from early stage surgery to definitive chemoradiation, and crucially, the vital role of palliative care in managing symptoms and maintaining quality of life. Let's begin with the fundamentals. What exactly is cervical cancer? Visual. On-screen diagram showing the female reproductive system, highlighting the uterus, cervix, internal OS, external OS, and vagina. Host. The cervix is the lower, narrow part of the uterus that connects the uterine cavity to the vagina. Anatomically, it is divided into two main regions. The ectocervix, the outer portion visible during a speculum examination, lined by stratified squamous epithelium. The endocervix, the inner canal leading into the uterine cavity, lined by simple columnar epithelium. The junction where these two cell types meet is called the squamocolumnar junction, SCJ. Over a woman's lifetime, especially during puberty and pregnancy, the location of this junction changes under hormonal influence. The area between the original squamocolumnar junction and the new squamocolumnar junction is known as the transformation zone. This transformation zone is the single most important anatomical landmark when discussing cervical cancer, because cells in this region undergo constant metaplasia, transforming from columnar cells to squamous cells. They are uniquely vulnerable to cellular alterations caused by viral infections. Over 90% of cervical neoplasias originate right here in the transformation zone. Histologically, cervical cancer is categorized into two primary types. Squamous cell carcinoma, SCC, accounting for roughly 70% to 80% of all cases, arising from the squamous epithelium of the ectocervix. Adenocarcinoma, accounting for approximately 15% to 25% of cases, arising from the mucus-secreting glandular cells of the endocervical canal. Adenocarcinomas are often harder to detect via routine Pap smears because they originate higher up in the canal. Less common histologies include adenosquamous carcinoma, neuroendocrine tumors, and clear cell carcinoma. Subscribe to the channel for others video.